Adenomyosis. It's a word you may not have heard before, yet it affects millions of women worldwide. This often silent condition can have a profound impact on a woman's quality of life. Despite its prevalence, adenomyosis remains widely misunderstood and underdiagnosed. Many women suffer for years without knowing the true cause of their pain. They are told their periods are normal, or that their symptoms are all in their head. This lack of awareness can be incredibly frustrating and isolating. The truth is, adenomyosis is far more common than many realize. Estimates suggest that it affects up to 20% of women. This makes it crucial to shed light on this condition and empower women with the knowledge they need to advocate for their health. It's time to break the silence surrounding adenomyosis and ensure that women are no longer suffering in silence. Adenomyosis is a gynecological condition that affects the uterus, the organ where a baby grows. The uterus has a lining called the endometrium. This lining thickens each month to prepare for pregnancy. If pregnancy doesn't occur, the lining sheds, resulting in a period. In adenomyosis, the endometrial tissue grows into the muscular wall of the uterus. This can cause pain, inflammation, and heavy bleeding. This abnormal growth disrupts the uterus, leading to symptoms. Understanding adenomyosis helps in diagnosis and treatment. Diagnosing adenomyosis can be challenging, even for experienced healthcare professionals. This is due in part to the fact that its symptoms often overlap with other conditions such as endometriosis, fibroids, and pelvic inflammatory disease. Many women with adenomyosis are initially misdiagnosed with these other conditions, leading to delays in proper treatment. This is further complicated by the fact that there is no single definitive test for adenomyosis. A pelvic exam may reveal an enlarged or tender uterus, but this finding is not exclusive to adenomyosis. Ultrasound can sometimes detect signs of the condition, but it is not always accurate. Magnetic resonance imaging, or MRI, is considered the gold standard for diagnosing adenomyosis, as it provides detailed images of the uterus. However, even MRI is not foolproof, and may not always be readily available or affordable. This diagnostic complexity underscores the need for a thorough evaluation and open communication between patients and their healthcare providers. Adenomyosis can manifest with a wide range of symptoms, varying in severity from woman to woman. Some women experience mild discomfort, while others endure debilitating pain that significantly impacts their daily lives. One of the most common symptoms of adenomyosis is pelvic pain. This pain can range from dull aches to sharp cramps and may be constant or intermittent. It often worsens during menstruation, earning it the nickname killer cramps. Heavy menstrual bleeding is another hallmark of adenomyosis. Women with this condition may soak through pads or tampons every hour, or experience bleeding that lasts for an unusually long duration. This excessive bleeding can lead to anemia, fatigue, and other health complications. Other symptoms of adenomyosis can include pain during intercourse, painful bowel movements, bloating, and infertility. The impact of these symptoms on a woman's quality of life can be profound. Many women with adenomyosis find it difficult to work, socialize, or engage in their usual activities. The constant pain and fatigue can take a toll on their emotional well-being, leading to anxiety, depression, and feelings of isolation. Unfortunately, there's no one-size-fits-all cure for adenomyosis. Treatment options vary depending on symptoms, age, and fertility desires. Pain management is often the first line of treatment. Over-the-counter pain relievers can help reduce inflammation and alleviate mild pain. For severe pain, doctors may prescribe stronger medications or hormonal therapies. Hormonal treatments aim to regulate the menstrual cycle and reduce endometrial tissue growth. These therapies can provide relief, but often come with side effects. When conservative treatments fail, surgery may be considered. Hysterectomy, the removal of the uterus, is the only definitive cure, but is a major surgery with potential risks. One of the most frustrating aspects of adenomyosis is the high rate of misdiagnosis. Many women suffer for years without a proper diagnosis, bouncing from doctor to doctor in search of answers. This misdiagnosis epidemic stems from a lack of awareness and understanding of adenomyosis among healthcare providers. The condition is often mistaken for other gynecological disorders, such as endometriosis or uterine fibroids, which share similar symptoms. Furthermore, the medical community has historically downplayed women's pain, leading to dismissals of adenomyosis symptoms as normal period pain or just stress. This dismissive attitude can be incredibly invalidating and prevent women from receiving the care they need. It is crucial for women to advocate for themselves and seek out healthcare providers who are knowledgeable about adenomyosis and other menstrual disorders. Don't be afraid to ask questions, request second opinions, and insist on thorough evaluations. Adenomyosis is a common and often painful condition that affects the uterus. It occurs when the tissue that normally lines the uterus grows into the muscular wall of the uterus. Symptoms of adenomyosis can vary but often include heavy menstrual bleeding, severe pelvic pain, and pain during intercourse. The condition can significantly impact a woman's quality of life, affecting her ability to work, socialize, and engage in everyday activities. Diagnosing adenomyosis can be challenging, as its symptoms overlap with other conditions. There is no single definitive test, and a combination of pelvic exam, ultrasound, and MRI may be necessary. Treatment options range from pain management and hormonal therapies to minimally invasive procedures and hysterectomy. The best course of treatment depends on the severity of symptoms, a woman's age, and her desire for future fertility. Misdiagnosis of adenomyosis is common, leading to delays in treatment and prolonged suffering. It is crucial for women to be aware of the condition, advocate for their health, and seek out knowledgeable healthcare providers. Section 8. The Power of a Second Opinion. Advocating for your health. If you suspect you may have adenomyosis or are unhappy with your current treatment plan, don't hesitate to seek a second opinion. Getting a second opinion is not about doubting your doctor's expertise. It's about gathering more information and ensuring you're making the best decisions for your health. A second opinion can provide a fresh perspective on your condition, confirm or challenge a previous diagnosis, and offer alternative treatment options. It can also empower you to take a more active role in your healthcare journey. When choosing a doctor for a second opinion, look for someone who specializes in gynecology and has experience diagnosing and treating adenomyosis. Don't be afraid to ask about their experience with the condition and their approach to treatment. Remember, you are your own best advocate. Don't be afraid to speak up, ask questions, and seek out the best possible care. Section 9. Breaking the silence. Sharing your adenomyosis story. For too long, adenomyosis has been shrouded in silence and stigma. Many women suffer in silence, unaware that their pain is not normal and that effective treatments exist. Breaking the silence is crucial for raising awareness, reducing stigma, and connecting women with the support they need. Sharing your story can help other women feel less alone, encourage them to seek help, and empower them to advocate for their health. There are many ways to share your story. You can talk to a trusted friend or family member, join an online support group, write about your experience, or connect with others on social media. Every voice matters in the fight against adenomyosis. By sharing your story, you are helping to create a world where women are no longer suffering in silence. Section 10. Seeking support and information resources for adenomyosis. Navigating the world of adenomyosis can feel overwhelming. Fortunately, there are many resources available to provide support, information, and a sense of community. Online support groups and forums can connect you with other women who understand what you're going through. These platforms offer a safe space to share experiences, ask questions, and find support. Organizations like the Endometriosis Foundation of America and the Center for Endometriosis Care provide valuable information about adenomyosis, including symptoms, diagnosis, and treatment options. They also advocate for research and raise awareness about the condition. Don't underestimate the power of connecting with others who understand. Sharing your story and learning from others can provide comfort, hope, and a sense of empowerment. Section 11. A call to action. Raising awareness for adenomyosis. Adenomyosis is a common, yet often overlooked condition that can have a significant impact on a woman's life. It's time to break the silence surrounding this condition and ensure that women receive the care and support they deserve. We can all play a role in raising awareness about adenomyosis. Talk to your friends and family, share information on social media, and support organizations dedicated to women's health. By working together, we can increase awareness, reduce stigma, and empower women to advocate for their health. Let's make adenomyosis a household name and ensure that no woman suffers in silence.